Good afternoon. My name is Kirk Mills. Today I'll be going over the lungs and some lung-related diseases. Today, mainly, we'll be talking about inhaling and exhaling, how that works, how the lungs, what atmospheric pressure and pressure inside your chest cavity have to do with that, and what muscles are used to breathe the air in and out. We'll be going over how why some people have larger lung capacities than others. We'll be going over asthma, which is a very popular disease process that we'll see patients with as nurses, so we'll need to know how to treat them. Very serious if you don't know how to treat it. We'll describe different medical interventions that we can do as a nurse to kind of help get them breathing better and feeling better, and what to teach the patient when they are having an asthma attack, what to do, and how to avoid asthma attacks. We'll involve some patient education, and we'll also talk about some resources that patients can look up within the Arizona Valley here to kind of help with their asthma situation. So without further ado, I have this cool little model, and these, as you can see, are the lungs. The balloon are the lungs. This is the diaphragm. We'll pretend this hard part is the intercostal muscles. So, a few things: atmospheric pressure. There's pressure, air. We can't really feel it because we're used to it, but there's pressure in the air, atmospheric pressure, and there's also a little bit of pressure in your lungs. So, what happens is when you go to inhale, the intercostal muscles between your ribs, they expand. So pretend that this cavity is getting bigger, and then your diaphragm also goes down as well. So when your diaphragm, this yellow balloon, goes down, it lowers the pressure in your chest cavity and in your lungs, and the atmospheric pressure is going to want to flush into your lungs to balance that out, and that's how you inhale. Kind of like osmolarity with like salt and water and stuff like that. If there's less salt in an area of water, that salt is probably going to go into that area and dilute it and kind of even everything out. So same thing with your air. So as you inhale, it expands, creating drops of pressure from 760 to 759. Atmospheric pressure 760. So the atmosphere is like, oh, got to even that out. So air goes into your trachea here and bronchi, and then it goes into your lungs here. So that's how you. And when you exhale, kind of the same thing. When you exhale, your intercostal muscles are squeezing in. Your diaphragm is going up. It's creating more pressure in that chest cavity and in the lungs. So when that pressure's on, it's higher than the atmospheric pressure. So, like we said, air likes to follow where the lower pressure is. And since the pressure in your lungs and your chest cavity now are higher than the outside, that air is going to get pushed out to from the 761 pressure gradient in your lungs to the 760 in the atmospheric pressure. Um, so yeah, I hope you enjoy that little demonstration. My model here, you see the lungs inflate. Next, we're going to talk about why people have different lung capacities. So, taller people tend to have longer lungs, longer lung lobes, more area to expand in their chest cavity so they can take in more. People who live at higher altitudes, they're able to take in more air. Their body kind of trains them to do that because there's not a lot of air or not a lot of oxygen in the air, so their lungs take in more air to get as much oxygen as possible. People who smoke and are obese, not surprisingly, have less lung capacity. The chemicals in the smoke damage the alveoli, damage the lungs, damage your windpipe and your trachea and your alveoli and your bronchi, and it really makes it hard for the lungs to expand when they have all that damage in there from the smoke. Obese people just they have all that fat in the chest and just more pressure there that doesn't allow expansion like we need, like we said, to get more air in. Um, asthma. So is a disease that your body kind of overreacts to like smoke or pollen and stuff like that. And I think it's protecting you from that, but it's actually constricting your airway quite a bit. So it really closes those airways. So like kind of like you think like it's getting this is like clenching down where you can't really get much air. So what we would do in that situation for someone with asthma would we want to sit them up real good in the bed, so it allows the lungs to expand and in a easier fashion. We would want to administer oxygen, means that they're blowing more oxygen in, and even though the airways are constricted, more oxygen is pouring into the lungs as much as possible. We want to give them a few medications, bronchodilators, like a breathing treatment. We want to give them that. It's kind of like they'll inhale this chemical that'll really open up the lungs and expand. It kind of relaxes the muscle tissue and relaxes the airway, and allows it to open up and let more air and oxygen in. So there's another medication called corticosteroids you can give intravenously or IM or what have you, and it will also allow to relax the airway and let more oxygen in as well. So those are two very important medications. So sit the patient up, apply oxygen, administer a breathing treatment, which is the bronchodilator we were talking about, and then if you need to, you can give them corticosteroids to really open up the airways as well. Just some patient education for asthma. Tell them to avoid high pollution days. Like we said, a pollutant really can trigger that asthma attack. Smoking is another thing. You shouldn't smoke if you have asthma because it can really damage the airways and really cause them to get irritated and constrict and stuff like that. So, community resources. There's a lot of resources. I'm trying to flip my camera around here. We have a bunch. Looking them up on your computer. We have. They're all local too. So we have the Arizona Asthma Coalition that's in Scottsdale, and they help teach and educate and assist people about asthma. Arizona Department of Health Services, they have online stuff where you can go to learn about asthma. The American Lung Association, that's a local number as well. We also have Asthma Athletics. They're really cool. They'll teach families about how to, children who are active in swimming and some other stuff like that. And they will teach you how to do sports with asthma and stuff like that, how to avoid asthma attacks. And Banner Asthma Support Group. So you can join some support groups for kids with asthma and stuff like that. They go to fun places like the zoo or Jump Street, stuff like that, to really teach kids about asthma, and it keeps the kids involved when they go to fun places like that. So I really hope you enjoyed my video, and thanks for watching.